For the 12 years of her life following her pregnancy, Ashrafi suffered from an acutely embarrassing medical condition called a fistula, which made her incontinent.
Whenever you have fistula, you will have continuous soaking of urine and stool, and you are smelly all the time. I mean, in normal circumstances, no man will like to stay with a woman who is passing urine all the time, who is passing stool all the time. You are smelly. You are, in our culture, you are napak. Usually, people start hating you. Some jinnat is on you, and even the woman herself thinks that she has done something bad and that God is punishing her.
Ashrafi is a resident of Gilgit, and she's one of countless Pakistani women suffering from vaginal fistulas, or VVFs as they're called. That's a condition which occurs when delivery is not conducted properly and labour is allowed to go on for too long, often at the hands of a dai.
उनका जो फर्स्ट बेबी जो हुआ था लेबर पेन ऑब्स्टेट्रिक लेबर में गई थी 3 दिन मुसलसल लेबर पेन के साथ थी उसके बाद इनको दाई एंडल केस हुआ था तो दाई एंडल केस के बाद ये हुआ था कि इनको आरवीएफ और बीवीएफ जो फिस्टुला वो दोनों बन गए थे जिसकी वजह से इनके हस्बैंड 1 साल के बाद इसको छोड़ दिया था
I operated on a woman in Swat actually. She was having this fistula for 43 years. 43 years, a small fistula, and she came and we operated on her, and she told me afterward that, Dr. Sahab, after 43 years, I will pray. Most of them are created by obstructed labor.
Obstructed labor is when, you know, the baby is too big to pass through the maternal pelvis. The baby's head keeps pressing on the bladder. The bladder is soft tissue and it's trying to negotiate the pelvis and it can't, and because of that the bladder's blood supply gets cut off and it can develop a hole.
After her disastrous delivery, Ashrafi's husband left her, and 12 years later her brother came to her rescue. He'd heard about a medical facility in Kohigod, Karachi, specializing in treating patients suffering from her condition.
जब ये शुरू में यहाँ आए थे सेंटर में ना किसी से बात करती थी ना किसी साथ बैठती थी कि वो अपने आप को गलत समझते इस मुआशरे में
Gul Bibi is another casualty of a pregnancy which was mismanaged by a dai, resulting in her developing a fistula. But in this ward, Gul Bibi's case is unique because she's the only woman here whose husband has stayed with her.
दाई आई थी दाई में बच्चा पैदा किया 3 दिन बच्चा पैदा नहीं हुआ सर पे फंस गई बहुत दाइयान आई थी एक दाइयान बच्चे को खींचकर बाहर निकाला फिर मेरा छोटा पेशाब और बड़ा पेशाब के रास्ते से आ रहने लगे 1-2 साल के बाद मैं इसी हालत में रहती थी
वहाँ पर अस्पताल भी मुहैया नहीं है डॉक्टर मुहैया नहीं है इसकी वजह से इसके सारे मसले ख़राब हो गए इसके नज़दीक आने की जो है किसी को नौयत नहीं होती थी कि इसके साथ मैं जाऊँ बैठूँ 5 मिनट 10 मिनट यानी सब की सब बेजार हो गई इससे तो मैं जो है आखिरकार इसको छोड़ नहीं सका
मैं खुलदार की रहने वाली हूँ 3 रात और 3 दिन मैं पैदल सफ़र चलती हूँ 4 पाई में बिठाकर 30 बंदे मुझे लेकर आइए
This Gul Bibi came from Kyodasht. I mean, Gul Bibi has seen, first time in her life, she has seen a road, a bulb, a telephone. They are just there on nature. And nature is not a good midwife. Nature is a very bad midwife. Nature causes maternal death, nature causes maternal mortality, nature causes fistula, nature causes all this kind of thing. In countries where they don't believe on nature and the midwife and nurses are available, those women doesn't suffer.
Sadly, while most fistula patients can be cured, the majority of them remain untreated, either because they don't know that they have a curable disease or because they can't afford the treatment.
The husband can get, 10 wives or whatever number he wants. So it's who's going to fund this, who's going to take her to hospital. The cow is more precious than the wife, especially in our rural setup.
99% patients are treatable. They are poor. If you go to any doctor, they will charge money. So this kind of treatment should be available free and should be given by the government. Surgery itself doesn't cost a lot, but patient has to stay in the hospital. That costs money. Usually, a normal patient, we spend about 4,000 to 5,000 rupees expenses. But the other things also, if include other things, it may cost 20,000 to 25,000 rupees, you know.
Ashrafi is finally ready to rebuild her life.
सब ने मिलकर इनका ख्याल रखा और जो है कमज़ोरी के बाद जब हमने खाना पीना दिया, उनके साथ उठना बैठा हमने शुरू कर लिया, बता दिया कि इस हालत में ऐसा कुछ भी नहीं होता, सबके साथ मिलना है जुलना है। और ये आज बहुत खुश है, सबके साथ मिलकर जुलकर खेलती हंसती रहती, सब कुछ है। जब ये आए थे तो शुरू में बहुत रोती थी, अब तो बिल्कुल भी रोना ख़त्म कर दिया इन्होंने। अब हर बात पे हंसती रहती है। नाशा
These women are victims of one of the greatest scourges women face in Pakistan. In fact, while fistulas are only part of the problem, childbirth is the leading killer of women in this country. And after the break, we look at just what some of the problems are.